Hello everyone, this is Olga Petryna and I'm here to share some updates from the virtual EULAR 2020 Congress. Today I would like to speak about studies and abstracts presented in the field of gout management and disease course. There are several abstracts that draw my attention, and one of the abstracts is OP0169, which is the national database study. It's a claims database from the US, including 190 million patients. In this database analysis, patients were divided in 4 groups. First group were patients with gout and diabetes. Second group, patients with diabetes alone without gout. Third group, gout alone. And of course, the fourth group was the control group with neither of the conditions. And in this analysis, it was shown that patients with both conditions at the same time had the highest rate of amputations at 0.77%, followed by diabetes alone at 0.461%. Gout alone had the lowest rate of the 3 with 0.162, but even with that, they had threefold higher rate of amputations compared to patients with none of the conditions. It only emphasizes that gout on its own is a dangerous condition, and when it's occurring together with diabetes, it can put patient at a grave danger. And of course, it requires a very strict serum uric acid control in patients who have both conditions and aggressive treatment. Second poster I would like to talk about is OP0168, which is a population-based study from Korean National Health Insurance Service. And this database includes patients from 2012-2018, and the goal of the study was to evaluate the risk of cardiovascular events in patients who were treated with febuxostat or allopurinol. The purpose of the study was to see if the rates are higher for either of the medications, and mostly because earlier, several years ago, CARES trial showed that patients who were treated with febuxostat tend to have a higher incidence rate of cardiovascular events. So re-evaluation of the CARES trial showed that actually increased cardiovascular events happen after stopping febuxostat and allopurinol abruptly. And the speculation was that possibly the abrupt change of serum uric acid could be contributing, or even cardiovascular gout attacks could be the cause, as some of the CT scans of the patients showed deposition of crystals of uric acid in the coronary arteries. So in this particular study from Korean National Database, the researchers found that both febuxostat and allopurinol were associated with higher incidence rate of myocardial infarction, with higher incidence rate of cardiovascular as well as cerebral incidents, both ischemic and hemorrhagic strokes. The researchers in the study concluded that it most likely is not the medication per se, but rather, again, the change of serum uric acid concentration, or even so-called cardiovascular gout attacks that are leading to this increased incidence of cardiovascular death. And it was based on the fact that most of the allopurinol febuxostat treatment are started usually a week or two after acute gout attack, so this abrupt change of concentration of uric acid again is considered an actual risk factor. I think it's an interesting information and worth further investigation. And then the last abstract I would like to talk about is OP0205, which updates us on phase 1 study of a novel urate1 inhibitor, DO120. This is the study of healthy adults, and in this study, patients were given novel urate inhibitor alone and in combination with febuxostat. And after 14-day treatment, it was considered to be safe. There was no serious adverse events. It was shown that it was well tolerated in a dose up to 20 milligram, and it led to significant decrease of serum uric acid level 4 to 8 hours after administration, and the effect lasted at least 24 hours. as well as the cumulative reduction of serum uric acid continued over 7 days. From the side effects, the most common were drowsiness. There's one grade 1 increase in creatinine levels and abdominal discomfort, but no major serious adverse events. So it's a potential therapeutic target, and it's worth continuing studies in this field. There's a lot more going on in this Congress, and if you would like to hear more about gout abstracts or any other studies, please follow us on Room Now. Thank you and have a good day.